The number of coronavirus infections rises to more than 1.5 million worldwide, and the United States faces its worst day yet. Hello, I'm Arnon Naidoo, and this is The Heat. As the world struggles to contain the coronavirus, we begin with encouraging news from the United Kingdom. British Prime Minister Boris Johnson is reported to be out of intensive care at St Thomas Hospital, where he's been cared for since Monday. A spokesperson for Downing Street said the Prime Minister is back on a ward where he's being closely monitored. The death toll continues to rise in the United States with more than 16,000 deaths. The epicenter, New York State, reported its single worst day on Wednesday with 799 deaths. And 6.6 million Americans filed for unemployment benefits, bringing the total number of claims to more than 16 million. Economists say the U.S. unemployment rate is now 13%, the worst since the Great Depression. CGTN's White House correspondent Nathan King joins us now live. And Nathan, how is the White House responding to these unemployment numbers?
Well, you know, it's a healthcare crisis and it's an economic crisis as well. And there is so many debates behind the scenes right now about how do you protect public health, but also protect the health of the U.S. economy. The one thing they are saying publicly is, look, this is just 3 weeks. We've forced essentially everyone to stay at home. This is not an economic crisis normally, and we are providing tons of stimulus, and there is more on the way for companies, for businesses, and for individuals. But, you know, it's starting to dawn on them just how big a hole it's going to be to dig out of this. Things aren't going to go back to normal overnight. But the US president, just at his coronavirus briefing just now, still is the sort of optimist in chief, if you like, seeing light at the end of a very dark tunnel.
I'm not sure a lot of people will ever be the same, but I think our country, from an economic standpoint, will end up being stronger than ever. We have tremendous stimulus. We have tremendous stimulus plans. We have things in the works that are going to really, I think, fire the country. I think that what's going to happen is we're going to have a big bounce rather than...
Well, there have been also some complaints about the fact that individual checks hadn't been mailed out, you know, the $1,200 per person up to $3,000 for a family of four. Apparently, according to the briefing just now, that will start in the coming week or so, and they are going back for more in Congress. The Republicans want another $250 billion for small business loans to keep people off those unemployment claims.
Nathan, U.S. health officials are also voicing concern about 3 additional United States cities. What can you tell us about that?
Well, particular concern for 3 additional cities, because there's concerns over lots of places. But yeah, and one's here, Washington, D.C., also Baltimore and Philadelphia. Anyone who knows the East Coast of America knows the I-95 corridor. We've all driven it a lot. It starts essentially New York on down, and all those cities go on the I-95. That's how viruses spread, and the fear is that now, as New York hopefully hits a peak, other cities on that I-95 corridor could start to peak as well. There is hope from New York's model. I know 799 people died in the last 24 hours. That's the highest yet. But hospitalizations are down, admissions to the intensive care units is down. That is suggesting, despite the horrendous death toll and caseload, that things may be turning, but not necessarily in the cities that I've just highlighted for you. They could be in for a second wave.
Thanks, Nathan. That's CGTN's Nathan King reporting from the White House. Well, for more now on the impact of the coronavirus in the United States, we turn to Dr. William Haseltine in New York. He's the chair and president of Access Health International and is best known for his groundbreaking work in HIV and AIDS. Dr. Haseltine, thanks so much for joining us.
Pleasure to be here.
We've just been reporting those very grim figures coming from New York State. 799 deaths on Wednesday alone in the state itself. 7,000 people have died across New York State. What is your assessment of what is happening in that state right now?
Well, we're definitely in the midst of a tragic epidemic. I live here in the middle of Manhattan. The city looks like it's deserted. People are quite worried. I am know people, many people who are infected, some who've died, and it's a pretty serious situation here.
Dr. Anthony Fauci with the National Institutes of Health, he's expressed cautious optimism. He says that the spread may be slowing in New York State. What do you make of that?
I certainly hope it's true. If what I observe with people staying inside, shops closed, every public service, every museum closed, the city is really closed down. That is hopefully a very positive sign to reduce person-to-person contact, which is how this virus spreads. It isn't, however, we're not doing what the East Asians have done, which is identifying people who are infected through testing, doing rigorous contact tracing, and mandatory isolation of those people in contact, regardless of their test result. And when I mean rigorous containment, that means in a room by yourself, and you don't step out of the door. That's what they did. That is not what we're doing.
Why is that?
It means, if anything, we can perhaps reduce the spread, but we're not going to eliminate it at nearly the rate which was done in East Asia.
Why is that not happening in the United States? Is it logistics? Is it a lack of equipment? What is it?
Lack of leadership, lack of preparation, a public health service which has been allowed to fall into some kind of rack and ruin and tatters. It's sort of paradoxical. We have such a great health system in many of our cities that we've controlled infectious diseases pretty well until now. And so people forgot about how important the fundamentals, the blocking and tackling of public health is, i.e. the ability to identify those infected, the ability to contact trace, the necessity for isolation in case of transmissible diseases. We're not good at it. And hopefully we'll learn our lesson and we'll get good and remain good. But right now we are not.
In fact,
East Asia had the advantage of, you might call it an advantage, they had the SARS and MERS epidemic. So they understood what this could do, not just to the health of people, but to economies. If I analyze why East Asia has done so well, is they understood what pandemics can do to economies. And therefore, they were willing to take really drastic action. And they were willing to prepare. You know, South Korea, that's done reasonably well in this epidemic, ran a simulation for a new SARS epidemic in December before they knew one was coming.
In fact, you wrote about that in an article in Forbes magazine in which you said that the pandemic is a big one in terms of lives lost and economies destroyed, but you point out that it's a big one not because this is an especially powerful virus, but because of the human reaction to it.
That's entirely correct. And it's a tragedy that didn't need to happen. The United States right now is leading the world in terms of the epidemic. And that is, for me as an American, as a scientist who spent his whole life fighting infectious diseases and other diseases, it's an unnecessary tragedy. Had we heeded the warnings out of China, which were clearly given, they weren't obscure, in January, we would have been in much better shape. Had we taken to heart the lessons of SARS and MERS, that coronaviruses that also cause colds could cause serious problems, we would have had a drug available which would have stopped this epidemic before it had a chance to get off the ground. Those drugs could have been available. We knew we needed them. And lest people think that it's only a cold virus. This virus is a cold virus with a nasty, nasty habit. But I remember back to the days when there was another cold virus. It's called the polio virus. Most people don't realize that that was a member of a broad family of cold viruses that also had a very nasty habit. I think we should get our act together and take cold viruses much more seriously now and in the future.
And Dr. Hasseltine, I'm wondering how seriously these guidelines that have been put out by the White House are being taken, because the U.S. Center for Disease Control, the Centers for Disease Control, I should say, has said that essential workers in healthcare and food supply who have been exposed to the virus but who've recovered, they can now return to work if they're not showing any symptoms. Is that advisable?
You know, if they are antibody positive, and ideally you'd want them to be neutralizing antibody positive, I think that is possible. We don't quite know enough about the virus. There was a recent report out of China that suggested that some people who recover from the virus don't have protective antibodies. And that fraction was rather large for people who were mildly ill and discharged from hospitals. They were ill enough to be in the hospital. But it was about a third of the people that were discharged after having been ill and in hospital that didn't seem to be able to protect themselves. So I don't think they're necessarily going to be a source of infection, but they might be reinfected.
If we look at China, if we look at the city of Wuhan, which is where this started, there was a 76-day lockdown there. Now that city has been reopened. People are allowed to move out of the city, move into the city. It's gradually returning to normal. What is the lesson from that city?
Well, there's a couple of lessons. First of all, to say the lockdown is over is a little bit of an exaggeration. The extreme aspects of the lockdown are over. But I have friends and people I'm in touch with in Wuhan, and it is by no means back to normal. For example, if you're going to leave the city, you've got to prove with your QR code that you are free of infection. Your temperature, you go into a restaurant, your temperature is taken, and you can't sit very close to one another. You can't have groups together. It's hardly back to normal. You had another part of your question. What's a lesson from that? The lesson for that is, if you want to, what the words are now, crushing the curve, you've got to be stricter than we are. You've got to if you want to end it so you can get back to work, the tougher you are in the early phases and the mid phases of this epidemic, the faster you're going to get back to work. We in the United States are not on track to get back to work in a normal way in any foreseeable future, given the way we are handling this infection.
What are your thoughts on the likelihood of a viable treatment coming to market very soon?
I don't know about market, but there are viable treatments right now which are protective anti-sera, a convalescent sera from a person who has a powerful neutralizing antibody response to this virus, so you can knock it out, can be used to treat somebody terminally ill. There are right now people in process of pooling those sera. They should be testing them for their ability to knock out the virus. So you then have a highly concentrated preparation called IgG. That could be used to treat patients and to protect workers for a period of 3 to 4 weeks. Those aren't commercial products. Those are things that the Public Health Service will do. We have, for example, in the US, over 300 plasma collection services, and many of those have been activated. So I think within the next month or two, already we have the beginnings of that. The next month or two, and maybe even sooner, we'll have some effective ways to protect healthcare workers and to treat those and save the lives of many. Let me also say that saving lives of people who are critically ill is an art form, and that the results can vary from 12% fatality when people are intubated to greater than 85% fatality, depending on where you're treated. So we should up our game so that most people have access to the best treatments that result in fewer fatalities once you are critically ill.
Dr. Heseltine, very quickly, I've only got about 20 seconds left. Would you be able, could you tell us, would the United States be prepared for the next pandemic? You said this is the big one, but perhaps the one positive thing that might come out of it is that we'd be prepared for the next one.
Well, we certainly aren't, and no country is. We can tell you in advance what's going to happen. We know sometime, could be tomorrow, it could be 20 years from now.
Right.
There will be another influenza epidemic, which is equivalent to the 1918 flu. And if we don't improve our game, it could kill 1 to 2 billion people. That is not an exaggeration.
Yeah. Okay.
1 to 2 billion. So we must take this lesson seriously.
Right.
I think we will.
Okay.
Because
Dr. Heseltine, I have to go now. We've run out of time. Dr. William Heseltine, thanks so much for joining us. Next, we'll discuss the efforts by researchers worldwide to find a vaccine. Stay with us. You're watching The Heat.
All you need to know about China. China 24, only on CGTN.
Welcome back to The Heat. As the death toll rises from the coronavirus, scientists around the world are racing to find a vaccine that will protect people from getting sick. Joining us now from Piacenza in Italy is Dr. Gloria Tagliani. She's a member of the COVID-19 task force with the Italian Civil Protection System. And from Palo Alto, California, Russ Altman is a professor of bioengineering, genetics, medicine, and biomedical data science at Stanford University. Thanks to both of you for joining us. Dr. Tagliani, let me start with you. The New York Times here in the United States is reporting that there are now more than 200 clinical trials being conducted, bringing together hospitals and laboratories all around the world. What is the significance of that?
It simply means that we have no real arms against this virus, and we are desperately searching for something that can at least reduce the viral load and that allows to manage the infection and the disease by the host, which is infected and which is apparently without any help, can go forward to difficult to treat complications.
So, Dr. Tagliani, are the labs right now, are they looking at a vaccine or are they looking at a treatment?
Well, probably both, but mostly a treatment, because a vaccine is a second phase and has to do with the healthy people. But what we desperately need is something to cure the affected ones, who are the majority of patients we take care of, because we can see, and indeed we see some patients, some subjects who are not ill and have only a subclinical infection, but they don't need any help at the moment. The patients who really desperately need an help and possibly a treatment, an effective treatment, are those who are diseased and who are in the hospital and gasping because they cannot breathe properly and they have to be ventilated, and finally, and possibly not, but some of them reach the intensive care units. Therefore, for those people, we desperately need a treatment.
Russ Altman, speaking about a vaccine, the World Health Organization believes that a pandemic will only end once a vaccine has been found. Let's listen to what they had to say.
The only way that we will overcome it is when we have achieved the status that everyone has been vaccinated by some future vaccine, that is, has achieved immunity, either from having been exposed to the virus or taken a vaccine that provides immunity.
So, Russ Altman, what is a realistic timeline for a vaccine?
Well, you know what the numbers that our experts at the companies say is it's 12 to 18 months. I am sure that the people are working and thinking very hard, and I know this for a fact, to say how much can we compress that timeline. I think you can think about two phases. The first phase is discovering the right vaccine components, figuring out the science and making sure that it will work. And then the second phase, very important, is the scale up to create literally millions and billions of doses of the vaccine. That's the part that people are trying to gear up for. Without even having the vaccine ready, certain commercial scale-ups can begin to some extent, so that as soon as we have something that works, we can use as much resources as possible to scale up and get those hundreds of millions of doses.
Russ, there have been vaccines found before for other types of viruses that have infected people. Is there anything that scientists can go back on to see how this one works?
You know, we've been working on very difficult, as you say, it's true, we've had some big successes, and there's also been ones that have been challenging. HIV comes to mind. That's actually helpful because it means that we've built up a big infrastructure for working very hard in creative and different ways to approach this problem of vaccine discovery. So I am confident that my colleagues who have spent their careers looking for vaccines against HIV and other difficult to treat diseases will now be able to turn their attention and use lots of those tools to create innovative ways to get a vaccine for this pandemic.
Dr. Taliani, I want to ask you about the situation where you are right now in Italy. There's been more than 17,000 people who've lost their lives to this virus in Italy, but officials say the number of infections are now going down. Does that give you hope? Does that encourage you that Italy may be past the worst of it?
Yes, sure. We hope, sincerely hope, that the number of new cases will decrease, steadily decrease, down as possible to a very limited number of cases and down to zero in the very short time, because the quarantine and lockdown has been put in place since now almost 4 weeks. And therefore, if we didn't have such results, it would have been useless. Therefore, we really hope that this number will decrease and will steadily decrease.
Russ Altman, when we look at the development of a vaccine, of course, there are scientists working in laboratories all over the world. How are they cooperating to find a vaccine here? I mean, in the absence of peer reviews, how do they do it now?
It is quite remarkable that the scientific community has come together. There is this thing called preprints. Preprints are before an article gets published in a peer-reviewed literature, you can send out an early copy for public inspection. The preprint servers have now blossomed with many reports from scientists about early indications of their work. Now, why is that important? Because that allows us to know who's working on what. We can pick up the phone or send an email. So in our own lab, for some of the work we're doing, we've been able to find collaborators all over the world with similar interests. So we make sure we don't duplicate effort. And so we make sure that we focus together on these projects. So it's really quite remarkable the way the scientific community has come together. And people are not worrying so much about who gets credit, which is often a barrier to normal scientific collaborations. Everybody understands that this is all hands on deck and will worry about credit either never or later.
So are you seeing that right now, experiencing that, this flow of information from one part of the world to the other?
Yes. So I have a collaborator in Germany who freely shared some of their early results at the Leibniz Primate Center. We're talking to some folks more locally, and I have yet to have an email or a phone call not taken. People are really wanting to help. It's a big positive thing that's happening in terms of international collaboration.
There are efforts in the United States to develop and distribute something called a serologic test that would identify patients who have developed immunity. How would this work?
This is very important. Thanks for asking. After a person is exposed to the virus, we presume that they're developing antibodies because of this exposure. Those antibodies, in most cases, are protective against further infection for at least a little bit of time, or else sometimes for a long time. We don't know yet, but it's absolutely critical to have these serological tests so that people who think they may have had it or know they had it, we can check for antibodies both for surveillance of the population to make sure that we know who has had the disease already and who hasn't, and also for the specific care of specific patients so we can understand whether or not they're dealing with a COVID infection or some other infection. So the testing of the active disease was the first thing, and now we're doing the very important serological testing for a history of exposure, either short-term or medium-term length.
Dr. Taliani, how important is it for every country to carry out testing, particularly when there are people who are asymptomatic? What's been the experience in Italy on testing?
I can refer to the experience we had here in Emilia-Romagna, which is the region where I stay with the civil the task force for COVID of the civil protection. And here we are performing the test on all medical operators, and we are tracing those who have been infected, who have been in contact with the virus, and we have recovered from the infection. And this is a very important point, because those persons are at no risk of danger and of disease, and therefore can be freely used and safely used for many activities. We protect ourselves in a very close way, but nevertheless, being aware of having been infected is a very important information for all of us.
Russ Altman, as we've been hearing, a vaccine could take some time, but what about treatments right now? There was a treatment that the Chinese were using about a month ago, or even earlier than that, which was a blood plasma treatment. What are the options that are available insofar as treatments are concerned?
Yeah, so there are a number of categories. One category is, are there any drugs already on the market that just fortuitously might help against the virus? That's called drug repurposing, and there are some indications that we might be able to find off-the-shelf drugs or prescription drugs that'll be useful. That's the first thing to look at, because it could move the fastest. Second of all, you could have the development of brand new drugs. That's going to take time. That's more like months to years. Actually, it's years. And then, as you just mentioned, it is possible that the people who have developed antibodies against the virus, if they were to be donors of those antibodies, that we could then transfuse those antibodies into patients who are severely ill to try to blunt the course of the disease. And so that's something that all of these, we don't have any proven things yet, but all of them are under intense scrutiny in research labs. And I can just assure you that if somebody gets positive results in that area, we will hear about it, and it will start to be deployed, especially for the most sick patients, as Dr. Taliani pointed out. They're the ones who we have to help get through the toughest period of infection.
Dr. Taliani, one other thing, and that is China has sent medical experts and supplies to Italy as it struggled and battled against this coronavirus pandemic. How critical was that help from China in helping Italy?
Of course, they had an experience that could be very helpful for us to organize at the best of the possibilities the pathways and the different ways to control and to treat patients, and it was very helpful under many respects. Nevertheless, each country has different criticisms, and therefore any country has to develop at the best of their possibilities a way to cope with infection, a way to put in place the best opportunity of treatment and control, and that's what we are doing at the moment.
Okay, and that's where we have to leave it. Thanks to both of you for being with us. That was Dr. Gloria Taliani and Professor Russ Altman talking to us. That's it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.